Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa Salvador, your certified aesthetic physician here at our new CSA Medical Aesthetics. In today's episode, we have a very special topic whereby we will be doing a so-called facial rejuvenation using the combination treatments like our PDO threads, PCL threads, and some dermal fillers. So we have with us here our guest, Miss Cherry De La Cruz. She's in her late 30s. And we will be joined by Dr. Ara Castillo, okay, one of our aesthetic physicians as well. And we will be discussing right now the so-called facial analysis. So, initially, we do really an assessment muna before we do any procedure. So, it is vital po na tingnan muna natin yung condition ng ating face, ng skin, and para mabigyan natin, ano ba ang best treatment sa ganong klase ng kondisyon ng mukha. Okay? So, we have a late 30s female patient right now. And of course, she came in to us para lang yung skin condition niya ma-improve, at the same time, yung face rejuvenation ma-achieve niya po. Kasi hindi nga tayo bumabata. Araw-araw, we're suffering from this so-called aging process. Okay? So, ang work ni ma'am is
OFW po ako, Dr.
Yes.
Sa Dubai. I'm
Okay.
a nurse reception.
Oh, nurse ang ating nurse receptionist. Okay. And of course, the work of a nurse receptionist, I think, is so stressful, right? So, you face different people, different kinds of people, and with different kinds of problem. And sometimes you're the parang ikaw yung anong tawag doon? Sa lahat ng shock absorber, yan. So, of course, pag sobrang stress tayo, anong nangyayari sa mukha natin? Na-accelerate ng aging process. So, may manonotice ka ng mga fine lines, wrinkles, nagsasag na yung face, may makikita ka ng mga laugh line dyan, mga deep wrinkles. So, we wanted to do something to prevent, to correct yung mga ganitong conditions natin. So, initially, we do yung analysis natin. We follow yung rule of ratios and proportions. So, meron tayong tinatawag na upper third, middle third, and lower third of the face. So, when we do the face ka sa kabilang side, so actually, when we do we have the so-called horizontal line, yung tinatawag na Frankfurt line. Ayan. So, yung upper third is comprising ng forehead, glabella, including na yun rin yung upper eyelid or brow area, and some of the temple area. So, sa mid-face naman, actually, when I do my mid-face, sinasama ko the ulnar groove, okay, the lower portion ng ulnar groove, and dun sa harap ng lower lobe ng ating ears. Okay. So, upper, middle, lower third. And when you do analysis, sa upper third ni Cherry, what do you notice, Doktora? Okay, some fine lines na, no? Yes. Right. So, common kasi sa atin, nagkakaroon ng mga forehead or tinatawag nating worry lines, o yung iba naman yung dito, yung may onse. So, minimal lang naman yung tinatawag naming frown lines, or iba, tiger line or lion line. And then, yung iba, may concern na rin na naghuhooded eye na, upper eyelid, droopy eyelid. So, isang concern na rin to. Aging starts at 30s daw kasi. Kaya, or even as early as 25, nag-start na ang aging. So, yung hooded eyes. Yung iba naman, yung may crow's feet dito. Okay? So, kay Cherry, I could say na so far okay pa naman. Actually, even if she don't do any Botox yet at the moment. Pero ang pinaka-concern actually when she came to me, yung sa mid-face area. Okay? Initial concern. Like yung under the eye area natin, ayan na, nagkakaroon na ng eye bag or puffy under eyes, leading to some dark circles. And then after that, nagkakaroon na ng volume loss here. Yung tinatawag nating Indian line, Indian groove or mid-cheek groove. And then pagka nagka-volume loss here, nagiging weak yung ating malar region here. This one. And then it becomes saggy or nagda-drop. Nahuhulog na siya. And then itong nasolabial fat compartment na to, nagiging saggy na rin, leading to a deep nasolabial crease there. So these are concerns ng mid-face natin. The others naman, sa temple region, nagkakaroon na ng sunken temple region. But the case of Cherry, she has a full temple. Pero dun sa medyo border ng forehead and the temple area, meron ng beginning hollowness here. Ayun. And dito, below the malar region, may beginning hollowness na. So that's how we do also the mid-face analysis. Then going to the lower face, okay, ideally we have the jawline definition here. Some people already begin to have yung mga tinatawag na laugh line dito or parang parenthesis. Yung iba naman dito, puppet line. And then yung iba dito, nagja-jowls. Ito ang tinatawag na jowling area here. And then yung iba nagsasag up to here. And nagkakaroon ng pre-jowl sulcus. For the case of Cherry, if we're gonna look at her, may beginning sagginess na itong jowl part niya. So, nagka-create na ng beginning puppet line. Right, Doctora? And we also check symmetry. We call symmetry, dapat we look at the, what do you call this, balance. So, yung ating right side and left side, you have to check kung pantay ba yung kanyang right and left. Kasi some people, may isang part na mas nagbabulge compared to the other part, or may isang side na mas maliit compared to the other part, the other side. O yung iba naman, mas sag ang kabila kaysa sa isang side. Right? So, looking at her, yung meron naman siyang actually symmetry. If you're gonna look at the facial line niya dito, meron namang symmetry. And then, in terms of the jaw, I mean the chin, okay, so pasok naman siya dun sa Ritter's line. So, this is normally how we do also facial analysis. Now, for the case of Cherry, priority, what do we prioritize? We wanted to do mid-face restoration of volume, and at the same time, with mechanical lift, pwede natin siyang lifting procedure with the PDO threads, as well as dito sa lower face, pwede tayong mag-lifting procedure with our PDO threads. So, yun ang magiging recommendation natin. Kasi there are patients who have a lot of concerns on their face, but it's best to do analysis muna, and which will be the first treatment you're gonna do. Ano yung pinaka best procedure that will give the best impact dun sa overall facial appearance. Okay? So, nasal aesthetics then, so far so good, although a little bit of enhancement lang sa kanyang dorsum of the nose to define the nose. Okay? Naging concern din ni Cherry actually yung under the eye area. So, what we're gonna do is volume restoration mid-face, itong mid-cheek groove na to, tsaka itong deep nasolabial. We're gonna pull from the temple region and the tragus region, and at the same time, correct yung puffy under eye. So, we have to restore yung kanyang younger look and also make her look refreshed, make her look glowing, yan, radiant, okay, rejuvenated with our combination fillers, PDO threads, and PCL threads. So, we'll show you the actual procedure sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So we will now show you the actual procedure for the combination face rejuvenation using dermal filler and thread lifting. Okay, so I have with me a Voluma hyaluronic filler, Dr. So this is a very good treatment for the volume restoration, especially on the mid-face area. So what we're gonna do is correct the mid-cheek groove. Okay, so we have a sagginess here. Yung midline natin. This is so-called Indian line. So, when she's upright, manonotice mo na nag-deepened or sunken yung dito sa midline or the Indian line or mid-cheek groove. Okay, so what we can do is, well, actually, we can have a point of injection here. Just do an IV bolus. We wanted to prevent or avoid yung tinatawag na infraorbital vessels here and nerve, yung structure dito. So, to do that, actually, a technique is like, you can have your index finger and your thumb here, and then injecting directly into the mid-cheek groove area. Okay. So, near the bone, aspirate, and then push. So, nandito yung ating vital structure. So, we wanted to push somehow like 0.2 to 0.4 ml here. So, bolus injection lang tayo. So, the purpose of this one is for volume restoration. So, take note of that. I just have to press kung saan yung infraorbital vessel. So, we're avoiding a danger zone there. Now, another one to correct is the deep nasolabial crease or line here. So, ideally, we just inject into the pyriform fossa here. So, near the alar groove. And on the bone, aspirate, and I can give as much as 0.2. So here I gave 0.3, I can give 0.2 here. This one will also help in the narrowing of the alars of the nose. Okay, so cherry, later on you feel like nagnanumb yung upper gum. Okay, so that's enough for that. So this is just 2-point injection for mid-face volume restoration as well as nasolabial correction here. Okay. So we can do on the other side, same thing lang. Okay. Again, meron siyang sunken dito, midline. So we can clean the area. So I'm using the Voluma Juvederm Hyaluronic Filler. It's a very good filler. Okay. So again, preventing or avoiding your infraorbital vessel there. Put on top of it your thumb. Okay. So I wanted to correct yung volume loss niya here. Okay, injecting into that area. Okay. Now I'm on the bone, aspirating, and then I can push as much as 0.2 to 0.3. How are you so far? And the next one again, yung deep nasolabial crease beside the alar groove, we can inject here. So what we want to avoid here is the facial artery. So you have to reach the periosteum or yung top ng bone natin. So you can inject as much as 0.2 to 0.3 here. So manonotice mo nagkakaroon na ng elevation. And when we inject it, we can do it slowly. So that's with our filler. Now next we will need to do super tornado eye bag threads. So we want to correct yung ating under eye problem. So yung concern niya, nagsasag na rin yung skin under the eye, and at the same time yung puffiness, so leading to the eye bag problem and some of the fine lines. Okay, so what I do, anesthetize yung sides of the eyes. So lidocaine here, inhale, exhale. So the lidocaine is giving that stinging sensation. Inhale, exhale lang. So this side will be my entry point. So Dr. Ara will do the other side. So we just need entry. Point of entry, I'm using a gauge 21. You can inject as much as 2 to 3 super tornado eye bag threads. So again, the goal of this one is to correct the puffiness under the eye. So we keep on mentioning thinner skin under the eye. It tends to sag, it tends to form lines, and or the others have a volume loss here or formation ng dark circles. So this is again super tornado. Super tornado easy cannula threads. Okay, just insert the thread. Okay, so the goal is to leave those floating threads inside. That's one. And entry point, I already made a point of entry. So in doing a correction or face rejuvenation, make sure that there is symmetry. So kailangan balance, right and left. Because beauty is balanced, beauty is harmonious, beauty is symmetrical. So if we're no longer within the ratio and proportions, then when we're no longer harmonious or there's no more balance, then we're not able to achieve that ideal aesthetics we want to to achieve for our clients. Okay, just push towards the midline. So ideally, we tell our patients after the procedure, do ice compress. Okay. So the next goal is to lift the mid-face, lift the nasolabial. We can make use of our PDO cog lift. And I anesthetize the hairline area here. So lidocaine. So I wanted to pull the nasolabial fold. Okay, anesthetize here. So this is lidocaine. It's quite giving this stinging sensation po. So inhale, exhale lang, cherry ha. I also do combination infraorbital nerve block. So towards the infraorbital nerve here, give this lidocaine here. So we need to do a lot of trainings in doing these kinds of procedure. Okay, and we have to understand the science behind those PDO threads as well as those dermal fillers. So, okay, point of entry will be this anterior to the hairline or temple region. Okay. Can make use of my PDO spiral cog. So I'm using a spiral cog PDO for my nasolabial lift. So point of entry lang po. And then you can actually pinch the skin like this and insert the full length of the cog. So inhale, exhale. So you have to push it all the way up to the nasolabial line, and you have to pass that nasolabial line. Inhale, exhale. So since our patient is just in her late 30s, we can do one mid-face cog lift and then I'll combine with some of my mono threads and tornado threads. Inhale, exhale. So this is actually a long cog thread. So I'll pull it out now. Okay. So there you go. So with one cog, I'm able to have that pulling effect already. So this is more of the mechanical lifting. Okay. So we can do another lifting for the marionette line. So I'll be anesthetizing in front of the tragus of the ear. About 2 to 3 centimeters anterior to that. So we'll have to inject a lidocaine here. So sorry about the lidocaine, cherry, okay? Stings a bit. As they keep on saying, no pain, no gain. So we have to anesthetize the area, and then this one too. We have the adjacent mentalis foramen here, then puncture again. So I'm using a gauge 19 needle for my puncturing. So in front of the tragus of the ear, you can make your puncture there. Inhale, exhale. Then again, I'm using the spiral cog thread PDO. Important to make a very good point of entry here, and then push the full length of your cannula towards the marionette line so you're able to pull that. Okay. So our goal is to do a jowl lifting or marionette line lifting here, or lower face lifting. So you have to pass that line, the marionette line, okay, to have a very good pull of the jowls. So this is the jowl area, so we have to pull that. Now we can do the tornado threads. So tornado threads, we'll make a collagen stimulation via using our either the PDO tornado threads or mono threads for the mid face, like tornado or any 50mm thread. So it's a so-called vector pull. Goal of this one is for collagen stimulation. So we want to build protein for support and structure. So a while ago was a mechanical lift using the cog, and this one is collagen stimulation for tightening and firming the skin. So we wanted to combat the sagginess, the laxity. So as time passes by, Cherry will just be rejuvenating and becoming younger and younger. And then on the lower part, we can still combine with those tornado threads. Okay. So since we're using needles, we expect some pinpoint bleeding there. And then last will be the jawline lifting. Jawline lifting, I can make use of also a long tornado PDO or twisted threads. Okay, so I can just continue with this one. This is a 90mm tornado. Okay, so we're doing the first right side, and I can use the last one to anchor the posterior part. This is for anchoring the posterior part of the face. Okay, so we have done the right side with fillers as well as the PDO threads. So we'll continue with the left side sa pagbabalik ng CSA Certified Skin Authority. So we're proceeding to the left side of the face. Okay, so we'll do the super tornado eye bag threads. So Dr. Ara, what is your comment dun sa first half?
So unang ginawa ni Doktor is she did the restoration. So she did the fillers first to restore the volume kasi meron ng volume loss yung patient. So second is to do the mechanical lift using the PDO threads. So, as you can see, lifted na po talaga yung kabila, no? Compared dun sa kabila. Although ginagawa pa ni Doktor yung other side. Pero this procedures talaga is an instant,
Result.
instant rejuvenation,
Yes.
instant result, and it's painless. Kita mo naman yung patient, di ba?
Yes, she's okay. Yeah. And we love it because of the natural result. So,
And
yun
how
yung
long
gusto
will it
nila.
last, Doktor?
Okay, initially,
The result.
yes, yung ginamit natin na Voluma dermal filler, yung study nila, it can even reach 24 months. And then the PDO threads, we always say 1 year or even more than a year depending on the metabolic rate or yung type of response ng ating patients. Kasi meron tong stimulation ng collagen formation. So, depende rin. Some patients of mine, like after a year, they come back for additional thread lifting.
So, in short, lifestyle is very important here.
Correct. Healthy life, healthy living. So, we advise them kasi we had yung dermal filler, so increase niya yung water intake. Tapos, for sources of our amino acids and protein formation, kailangan natin ng protein-rich diet also. Okay. So, yung concern kasi, yung nagsasag na yung ating face, mid-face and lower face. So, we're correcting yung sagginess. So, meron tayong lifting and pulling. So, this is PDO na. So, again, we're trying to pull the nasolabial fold there para ma-obliterate natin yung nasolabial crease. Okay, inhale, exhale lang.
So, for patients with, Doktor, with diabetes or hypertension, is this, contraindicated?
Well, before we do any procedure talaga, we have to check our patient's medical condition, di ba, Doctor? That's why we take the history.
Yes.
So, of course, kung hindi controlled yung blood sugar and hindi rin controlled ang blood pressure, we don't do the procedure.
So, as long as it's controlled.
Exactly. So, we actually even had patients na naka-maintain for their DM or diabetes mellitus, or meron tayong patients na naka-maintain for high blood pressure since controlled naman. So, we can do these kinds of procedure. So, anything you have to really check, ano ba yung mga contraindications. So, priority pa rin natin yung health ng ating patient. And bata pa ang ating patient si Cherry. She's just in her late 30s. So, very young. The earlier you start, the better. Right? Kasi pagka, syempre, older na, and talagang super sag na, and actually, kung severe na yung sagginess, ang first recommendation natin is to do surgical facelifting. Although we can still recommend this kung ayaw nila ng surgery, but then we need more threads, more pulling, more lifting, and mas early yung repeat procedure nila. Of course, when we are doing non-surgical procedures, anything that's natural or from nature, meron siyang lifespan. So you can just do repeat treatments to maintain the clinical outcome you want to achieve. So right now, Dr. can do the tornado. Okay, so 10 PDO tornado threads, PDO millimeter dito, Dr. Okay, so that's a vector pull. Okay, so that's one technique you can also do. Actually, one treatment is also to do a vertical lifting technique. So, doctor is doing the vertical lifting or towards the malar region. You can actually follow the shape of the mid-cheek area. Kasi ideally, you have to restore yung tinatawag na OG curve ng ating mid-face. That OG curve, that's yung shape na merong roundedness yung ating mid-face. Or well-pronounced ang mid-face natin. So, this is doing the tornado 50mm PDO for the mid-face lift. Okay. And it's also best to combine. I also do inch threads for this one to achieve that apple cheek appearance. And right now kasi common to have that V-shaped face. So people want to have a V contour or V line or V face line. You can already achieve that with our PDO threads also. And then the last will be the tornado 90mm PDO for the lower face. So that's a very good technique also. It's like following the curve of the mid face or the cheek. Okay, so this is a 90mm tornado. Okay, yeah, you can do 4 there, you can do 1 here. So the goal here is to pull your marionette line. Kasi as we age nga naman, we develop this marionette or the puppet line because of the jowling effect. Nagiging loose yung ating skin, yung ating tissues inside. And aging process actually also yung ating mga tissues sa loob, they tend to atrophy due to the aging process. Okay, so this is PDO tornado. So there are several kinds of threads out in the market right now. So you'll notice meron na yung mga cog threads or barbed threads, non-barbed threads, may mono threads, may tornado threads, yung mga screw type or twisted threads or double twist threads. Marami na pong klase. They even are introducing right now yung mga tinatawag na scaffold and cog threads, royal cog, spiral cog, and even yung tinatawag na fixed threads. So they give a stronger hold onto the tissues, a powerful hold sa mga tissues natin para talagang stronger yung pull, and the threads are more fixated or naka-fix talaga sila sa loob ng ating mga tissues. So we have done a full face rejuvenation using our dermal filler and our threads. Now we'll show the clinical outcome to Cherry. So Cherry, ito na po ang ating maywagang salamin. Okay, ayan na po.
Wow.
Wow, Doc.
Yan naman, diba?
Yes. So ano na-notice
Total
mo, Cherry?
rejuvenation talaga.
Nawala na yung mga laugh line ko, Doc.
Yes. Yun yung noticeable. Yung deep laugh line, nag-angat. Okay? And mapapansin mo kasi kanina parang sag eh. Mid-face and lower face sag. Pero ngayon, meron na rin siyang pulling, lifting. Yon. And actually, this one, as time passes by, lalo pa siyang nagli-lift. And yung mga threads na nilagay natin sa mid-face and lower face, yung mga tornado threads, they stimulate collagen formation. So, as time passes by, nagkakaroon pa ng skin tightening, firming, and better lifting, and better improvement. At saka yung texture ng skin, lalong gumaganda. O yan, sa inyo po na may mga katanungan, you may email me at csaskinclinic@yahoo.com. Our clinic is located here at the second floor, Pure Gold Dau Building, Dau MacArthur Highway, Mabalacat, Pampanga. Contact number 04533111117 or 093386099193. Or you may also reach me at my FB page, CSA Derm Centre and CSA Medical Aesthetics. Actually, we're now the CSA Medical Aesthetics. And then ang aking FB Messenger, Contessa Salvador Alapag, Instagram doc_Contessa. Kung na-miss nyo po ang aming mga ibang videos or episodes, you may actually check yung mga iba pa naming topics. It's already in the YouTube channel. Only type Contessa Salvador. And please do not forget to click like and subscribe as well. So maraming salamat po sa inyong lahat. Actually, we will be having an international conference. It's the Asia PDO Experts Meeting. We're inviting our colleagues, our doctors to attend that very informative kind of workshop and lectures on the PDO thread lifting, the different uses, applications, safety profile, advantages, and saan namin siya ginagamit. Okay, so we'll see you there, Dr. Ara.
Thank you.
Okay, it's an international conference.
It's an honor.
Yes, okay. So, we'll share it to our televiewers sa mga susunod nating mga episodes. Okay, thank you, Cherry.
Thank you, Doc.
Thank you, Dr. Thank you, Sandra, to my assistant, and sa inyong lahat, maraming salamat po. So when it comes to natural beauty, you can trust the CSA Certified Skin Authority.